Well, thanks for the invitation to present our work. I'm presenting this on behalf of our team, including Navia Abele, who can't be with us today. She is on a medical mission in Ukraine. We'll be talking about fracture and changes in physical function thereafter. So people with HIV have an increased risk of fracture compared to people without HIV, even in middle age. And the concern, of course, is that these fractures increase subsequent morbidity, but also mortality. In the general population, osteoporotic fractures can lead to a subsequent loss in physical function. And in some cases, there may be failure to recover, and this may worsen the aging trajectory over time. So we hypothesize that individuals who have an osteoporotic fracture will have a faster decrease in grip strength and gait speed compared to persons without a fracture, and that the magnitude of the decrease will vary by HIV status. We also hypothesize that persons who have a fracture will not recover to their baseline status. So we identified men in the multicenter AIDS cohort study who self-reported an osteoporotic fracture. So this is at the spine, hip, upper arm, or wrist at any semi-annual visit after 2006, in which the fracture visit was considered the index visit. We matched the men to those cases, the men with fractures, to the controls by age, HIV status, and age at the index visit. The outcome variables that we used was the grip strength and gait speed. Both we've done in the max semi-annually since 2007. So grip strength was the average of 3 trials on a JMR dynamometer. Gait speed was over a 4-meter course at usual pace, and the faster of 2 trials was used. So we used multi-level mixed effects linear regression models to compare changes in grip strength and gait speed in men with and without fracture in 3 periods. So we wanted to look in the years before the fracture, this index visit, the 2 years after the index visit to look at sort of an acute effect, and then a recovery effect by looking at 2 to 5 years after the index visit. We adjusted for age, race, BMI, education, smoking, binge drinking, and a comorbidity score. So here are the characteristics of the participants. So we had 115 fracture cases matched to 113 controls. You can see by design they have the same age, race is the same. They're about half and half HIV positive, HIV negative, and you can see the other factors here. The actual types of fractures, so most fractures were of the wrist or humerus, 62%, and you saw 25% spine and 10% hip. So I'll go for the results now. So I'm showing you now the grip strength in the control group. And so I'll orient you, the x-axis is the year since the fracture. That dotted line in the middle is the fracture time in the people who have had fractures. So that's what we consider the index visit. And what you see here is that there's a slow, steady decline in grip strength in the control group. So what do the cases look like? So there's a slow decline, maybe a little bit different at baseline. There's a lower grip strength at the index visit at the time of fracture by about 2 kilos in the cases versus the controls. There is a steeper decline compared to the controls right after the visit in the first 2 years. And so then the question is, well, what happens in the next phase, in the recovery phase? And it turns out that they do recover. So they come up pretty much to baseline, and there's about a 1.05 kilo per year versus control. So very encouraging for grip strength. So what about the pattern by HIV status? Here we're cutting the pie pretty small here. So there is a difference, and this is between the people without HIV at the index visit, a tendency towards a decreased grip strength at that visit. But the decline seems to be steeper in the people with HIV during that 0 to 2 year period. Compared to the people without HIV, but both of them recover by year 2 to 5. So what about gait speed? And so this has actually two splines in it, but it's a straight line. So gait speed declines continuously over this period in the people who don't have a fracture. What about the people who do have a fracture? And so this is what they look like. They actually have a tendency to have a lower gait speed at the index visit. And the decline is actually a little bit faster. It's not statistically significantly so, but they actually decline before the fracture actually happens. And they don't have the decline afterwards, so they come back up to where the control group is within 2 years. So this is the gait speed by HIV status, and basically the same patterns are found. So this is one question was whether or not if we stratify the fractures by the wrist and arm fractures versus the spine and hip fractures, would we be seeing anything different? And so what you have here is the differences between cases and controls, the value at baseline, the annual change in that 0 to 2 year, and then the annual change in that recovery period, 2 to 5 years. And what you see is the point estimates and the p-values is that for for grip strength, the spine and hip, the changes were the change down, the 0 to 2 was greater than just the wrist and arm, which you might expect, but the recovery was bigger too. So a bigger down and a bigger up, but back to the same place. Interestingly, the grip strength at baseline seemed to be lower in the wrist and the arm versus spine and the hip. And pretty much the same trajectories for gait speed. So in conclusion, osteoporotic fractures were associated with a decline in grip strength in the first 2 years after fracture, followed by an upward trajectory in the subsequent 2 to 5 year period after fracture. The magnitude of decline in grip strength from baseline to 2 years appeared to be greater among men with HIV versus men without HIV. The decline in grip strength in the 2 years post-fracture and the subsequent increase in the next 3 years were greater in spine and hip versus wrist and arm. The decreases in gait speed start to occur before the fracture, but recovery 2 years after. So the overall conclusion is men with and without HIV appeared to recover physical function within 5 years after fracture. Thanks for your attention.
Yeah.